Hi, everyone, and welcome today to our Chronic Rhinosinusitis with Nasal Polyps Awareness Day webinar for 2024. We are so thankful that you have joined us today. Today, you can expect to hear a conversation between our medical expert and two individuals themselves who have CRS with NP. You might hear us refer to it as nasal polyps simply for brevity. If you'd like to hear this event in Spanish, be sure to click on the globe at the bottom of your Zoom window and choose Spanish as your translation language. So again, thank you for being here. Let's get started. Let me tell you a little bit more about our speakers. Dr. Elina Jerschow is a board-certified allergist and immunologist with the Mayo Clinic in Minnesota in the United States. She has expertise in aspirin-exacerbated respiratory disease, or AERD, chronic rhinosinusitis with nasal polypsosis, and asthma. She's also the chair of the allergy division at the Mayo Clinic. Welcome.
Thank you.
We also have Victor Gascon Moreno. Many of you know him very well. He is not a stranger to most people watching this today. Victor is the VP of Awareness and Operations here at GAAPP. So I work alongside him every day. I feel very lucky to do so. He is joining us from Vienna, Austria. And last, we have Mitch Silva. He is here from Brussels today. He is the founder of Patient Centrics and Asperity, and his organization provides technology to understand patient profiles better, which in turn personalizes patient education. He's also co-authored a book on patient engagement for the life science industry and has his PhD in bioengineering. So Victor and Mitch today will be speaking to us about their experiences with nasal polyps as patients. So we thank you both for joining us as well.
Thank you very much.
Thank you, Christine. Happy to
Sure.
be here.
Should be a great conversation. So I'm going to stop my share. We've got everyone on screen for this nice conversation. Let's start with sort of the basics here. I know it is difficult to estimate prevalence, Dr. Jerschow, but I understand that in some populations, this could be relatively common. So just can you start with the basics for us about what is chronic rhinosinusitis with nasal polyps and what causes this condition?
Yeah, that's a great question. Thank you, Christine. So I don't think we really know the causes. We know that acute exacerbations or worsening of the disease are frequently related to an infection. But the actual cause of the condition, I don't think it's very well known or established. One thing we noticed from research is that there are some differences across the globe. For example, in Europe and the United States, we tend to have more eosinophilic sinusitis. So eosinophils are white blood cells that evolutionarily have been developed to fight parasites. But now in the Western world, we don't have that many parasites. And so I feel like they get bored and they start fighting something that basically is normal exposure, shouldn't be fought as such. And so with this impression from eosinophils, we have a lot of activity in the tissue of the sinuses that eventually leads to nasal polyp growth. And that makes people miserable. So the more eosinophils people have in the tissue or in the blood, the less well they feel, or basically they feel not very well. Now, in China, for example, there is some good research that has been done so far. It seems that the condition is quite different. So they don't have many eosinophils. They do have other blood cells, white blood cells also, called neutrophils. And this is their description of the polyps. They also have fewer cases of patients who have nasal polyps with aspirin or other non-steroidal anti-inflammatory drug sensitivity, at least according to recent studies that came from China. So the prevalence now, very hard to estimate because it would require us to do some prospective studies, meaning we start following patients when they're still well, don't have the disease, and continue following them for many years or many decades, actually. And then we'll pick some that will have the disease. And because the disease by itself is not as common as, for example, high blood pressure, it will be harder to find such individuals. So all we base our knowledge on is what we have in specific groups of patients in different clusters of the world. It looks like if patients have asthma, they are more likely to have sinusitis with nasal polyposis or without as well. If patients have asthma and nasal polyps as well, they might be at a higher risk of developing aspirin/non-steroidal anti-inflammatory drug sensitivity. And those drugs include pretty much many or most medications that we use for pain. In many countries, those are over-the-counter. You don't need a prescription, and that would include ibuprofen, naproxen. In Europe, I think it's Voltaren, maybe in South America as well. So those are the medications that I'm referring to. And in this population, so let's say patients with asthma, we're thinking maybe about 15% of people will have the condition of nasal polyposis with polyps, with the sinusitis. And if patients have both asthma and nasal polyposis, then they have sensitivity to NSAIDs closer to 25 to 40%, depends on the study. So this is a long answer to your question, but that's what we know so far.
No, I think that's really comprehensive. And I think that will help people to understand, no matter where they are in the world, right, sort of what's happening with people with nasal polyps where they live. So let's hear firsthand from the two people that we brought here who actually experienced these. Can you tell us a little bit about what symptoms you first experienced and your diagnostic journey with nasal polyps? Let me ask Mitchell first.
Thank you very much for this question. And also, Dr. Jerschow, I think your explanation is really resonating. So I can really confirm, actually, from my side, at least in my individual case, that there is a history of asthma. There is also a history of eosinophilic syndrome as well. And actually, my very first symptom was really asthma. And this was, I think, when I was like 22 years old or something. But over the years, the symptoms got worse, and I had like really some intense episodes where I really was just stuffed, and the physicians just prescribed short-term bursts of oral corticosteroids, and then okay, it went away. It was okay for a few months, and then another burst, and this went on and on until at one moment I just hit the wall, let's say, ended up in the emergency room where I actually had infiltrates due to eosinophils in my pleura. Which caused a lot of pain and fever, etc. But throughout this whole journey, nasal polyps were a constant. And at the end, it just got worse and worse and worse until even moments where, it's yes, your nose is so stuffed, basically, that you cannot breathe. You don't sleep. You even have difficulties like speaking, presenting. I often present and teach as well. And somehow it really has a very big impact on your daily activities that I think a lot of people that don't really go through this don't realize what the impact is of this disease. So my history really, I would say, started with asthma, and then I think exactly like Dr. Jerschow explained, this co-development of nasal polyps, and they just got worse. And so these were my initial touch points with the disease.
So I'll ask just one quick follow-up question. So what type of doctor was it that ultimately diagnosed you?
Yes, this was a long trajectory. The full trajectory took 7 years. So 7 years from first, a GP, and then referral to a pneumologist, and then follow up with pneumologist, and then ended up at the end with a internal medicine specialist checking, especially the eosinophilic syndromes, etc. Then referral to ENT. At the end, I also got surgery and a whole bunch of biologics that I'm sure we'll cover in a moment. So it's really a spectrum. And I think, why did it take 7 years? And this at the end empowered me as an individual to do what I do, is try to come up with, just ways to empower patients, because 7 years is too far. We have to do something with the community to shorten this period.
I think you're getting nods from all of the speakers. Yes, absolutely. Everyone agrees with that. And that's a very long time to struggle with a condition before you even know what it is. Thanks, Mitch. Let me ask Victor if you would share with us what your diagnosis looked like.
So mine, I think my case was a little bit special. So first of all, I'm a patient advocate myself. So that means I take care of every patient in the world except myself, right? That's what we do. So I used to live in Southeast Asia. That's when my symptoms started. So I have like very stuffy nose, running nose, sometimes breathing problems or for exercise, but you always blame it on, oh, it's the weather because it's very humid here. So I just keep changing countries and from the coldest part of China to Southeast Asia. So I just blame it on the weather because I had that I had all those symptoms, sorry, and they affected my quality of life. But it was not as bad as I have to take immediate action. And I was living in countries where I was not part of the public health system, right? Like the public universal health system. So every visit to the doctor it has to be out of pocket. In my case, so I was in that what I call the primary care trap for like 10 years, because when your system's worsening, you will go to the doctor, but your first point of doctor so I have lived in 5 countries. 5 of them I have the same problem. You will have to go to your primary care. The doctor, they will just give you antihistaminics and then just move on with your life, because there is something always more important than that, right? Because you go and then maybe you have, like me, I have cholesterol, and sometimes you have an injury and you have this, right? So you have 5 minutes. So what is more important, cholesterol and your injury in your leg? And for this, just take antihistaminics. I know that was not the solution. It was the wrong treatment, but it was a quick relief. And with the time, as you will hear, I noticed the damage on that. So 10 years went by, different countries, and I'm now living in Austria, in Europe. And one day the symptoms were very bad, until the point that it was difficult for me to speak. We were in an event together. My running nose was really, really severe. I had a headache, permanent headache. So until actually I talked with some of my colleagues and other patients, and they just told me, I think you have nasal polyps. And I was like, no, come on, you're crazy. It's just humidity. It's just like the weather. And so I went to the doctor, but I have to push my primary care doctor, even here in Austria, to tell her, like, I think this cannot be just deal with antihistaminics anymore. And I don't like antihistaminics because even though they say they don't make you sleepy, for me, all of them make you very sleepy. Mm. So I had to push and for until I got upgraded to the allergologist, so to say. And that's when they discovered that I did had chronic rhinosinusitis. I had a big nasal polyp here in this nostril, and I let it run and treat it for so many years. Part of my tissue was missing until I had a CT scan, and they told me if I had surgery before. I said no, and they said, but you have a very big piece of tissue missing, and I also had some maxillar affectation. I don't know what is the correlation, but I also had to go to the dentist after that. Mm. There was some separation in my maxillar bone. So the let's say the story here is like, you should get diagnosed as soon as possible. Don't be me.
Well, I wonder if this is common in people who are diagnosed with nasal polyps. Between the two of you, we're talking about 17 years. So is that something that we see often, Dr. Jerschow?
Yeah, well, first of all, I'd like to thank both Mitch and Victor for sharing their experience. It's always, when I hear these stories, it's always heartbreaking. And I feel we don't have enough emphasis among physicians in training on how to diagnose this condition. There are certain diseases, like, I already mentioned high blood pressure, but let's say diabetes is another one, because it's so prevalent in the population. So up to 10% could be affected in special age groups, right? So maybe not the whole country, 10%, but age group wise, like after 50 or maybe after 60, the prevalence increases. And so we pay a lot of attention to that, and we know how to handle this. But nasal polyps remain mysterious for many doctors. And because they don't know how to handle it, I feel this is where the delay comes into the picture. Yes, it is quite common. We just published a study from the cohort that I worked with before moving to Mayo Clinic, which was in Bronx, New York. And in this cohort, we found out that the median time of delay for diagnosis was 3 years, but the range was exceptionally wide. I think it went up all the way up to 25. So a few patients had 25 years delay in the diagnosis. And even just recently, I saw a patient at Mayo Clinic who came at the age of 73, and she told me all 3 symptoms: asthma, nasal polyps, and aspirin sensitivity, but she didn't know they are all related. So until we met, she said, really, I didn't realize there was a connection. So definitely we need to put more effort into education, and I think exactly that's what you are doing today. So thank you for creating this day, awareness day, for people who benefit from knowing about it more. I think for the patients who are possibly listening to us and wondering if they may have it, I'm thinking about, one very simple screening questions for nasal polyps, and that's actually the sense of smell. And I'd like to ask both Mitch and Victor, like, did you experience this lack of sense of smell when you started having your symptoms, even before knowing that you had the polyps?
Very great question. And I really think this was one of the things that really had a very big impact on the quality of life. Because at the end, the moment that, imagine you just don't smell anything. Yeah? So this means you can't smell good food. So if I like eating as well, so this is something you miss. But also if something goes bad in the fridge, you don't smell that. So everything, it blocks a full dimension of your life, basically. And what was interesting is that, okay, I sometimes had this episode where I could smell something, and then especially, of course, when you're on corticosteroids, you have these super senses, and then suddenly it goes away. But at the end, it also has an impact on insecurity, because there's really a sensation, there's a dimension of your senses that you're missing. And this, for me, honestly, I'm so happy with my new treatment now, because this is really, day and night difference in terms of quality of life. And for me, the biggest improvement is actually that I have again my sense of smell, and it's really like, wow, you just enjoy so many things because of this ability to smell, and I think a lot of people also underestimate what the impact is of not smelling. I don't know, Victor, if you also had the same sensation.
So I think in that sense, I was lucky. I didn't lose the sense of smell, but when I did have the symptoms and they weren't treated, I couldn't smell anything. But now, if I think about all these years, how many times I thought I had COVID and I just didn't care because it was a lockdown, because I couldn't smell. So it's, oh, this is just another round of COVID. It's okay. I'm home. I'm not infecting anyone. So, but now that I'm treated, I do have a sense of smell.
Great. Yeah.
So interesting. So interesting. And we'll talk a little bit more about next steps next, because I'm sure those are things that prompted you to move forward, especially with you, Mitch, right? This is terrible. Let me go get this scene taken care of. So this is really open to anyone. I'm very interested to see what you all have to say. After someone receives a diagnosis, what do you think are their best next steps from your personal perspective or your professional perspective? I'll try to open that to anyone who'd like to respond.
I think it would be great if Mitch and Victor will go first, because I think it's really important to know this firsthand experience from the person who actually went through this nightmare, and so that you guys can share with others what you think should be done as the next step.
No, great. I'll be happy to give a first shot here. So I think it would be good, I think, to really inform yourself as a patient. Informing yourself meaning, okay, what questions should I ask the physicians if I am the situation that you did have problems with smelling, that you have asthma, has all the symptoms that Dr. Jerschow just mentioned. Like what questions to ask really goes from, okay, might it be something related to nasal polyps? What are the possible treatment options? What if I would not respond in first line to this treatment? What are then the options? What about surgery? Now, what are the risks of surgery, but also, okay, what are potential benefits as well? And so I think if I would really ask these questions way before, I would really have saved like 6 years of just negative quality of life, basically. Looking back, what would I have changed personally in my trajectory? As I think, first of all, maybe also a faster referral as well. Like, should I see an ENT specialist? Because at the end, you know, I think in this whole area of nasal polyps, etc., the problem is that often it's linked to a multisystemic dimension somehow, that certain diseases might you have this as a symptom, and then you're always classified lung problems, pneumology, cardiology, cardiologist, etc. And here, if you don't, because often, like I think Victor said as well, like, okay, I can live with this. It's not that I'm dying, so I keep on going, and you just push that back as not the priority field to look for answers. So I think if you really are conscious about, okay, what is impacting my quality of life? And in my case, it was, okay, breathing, not be able to sleep decently, to speak, to smell, all of this. If you can solve this with one visit, let's say multiple visits, with one start visits to ENT, it can really change your course, I think. Also very important is if you have different other symptoms, like for example, asthmatic symptoms, bring your pneumologist with the ENT together. And this was something that I did as well, especially with the new novel treatments, is to say, okay, I know that these are potential treatment options, but my ENT doesn't speak about it. My pneumologist speaks about it. So how can you make sure that you have this joint decision where you as a patient are actively participating in this patient-physician conversation, shared decision making? So ask the questions to really bring together the different specialisms, ask questions about what are potential treatments also in clinical trials. Because in my case, I actually went to experimental treatments. So I was actually looking to what are the clinical trials out there, because I don't want to take oral corticosteroids my entire life, because we all know what the consequences are. So also ask yourself, what are the treatments that are available in a clinical trial setting?
Very nice. That's a very comprehensive response. Victor, I know you're about to say something, I can tell. Go ahead.
No, I say he took like the answer from my mouth. I think I would say educate yourself. There is a lot of there is not much, but now we're starting to have many resources out there, educational resources, and what is this disease, what is the next step, right? Like if you have this, you may also have asthma or other type 2 overlapping disease. So have that conversation with your doctor if you think that the symptoms kind of match what you have, and have conversation with everyone. Like, for example, this is a little bit not so important, but I had a conversation with a pharmacist, and they give me like a nasal wash that I do every night, and that helps me to snore less. I breathe, I rest better at night. I don't wake up at night. It's a very small thing, but it kind of improves your quality of life, your family life, because this is also affects your life at home, right? Your sexual life, everything, because it's gross, right? Like
and the all important aspects of life, right? We're not just talking about daily functioning, but it's important, I think, to talk about things like intimacy being impacted, because it's really all facets of your life. I think that's helpful to a lot of people who are listening and also likely have had that experiences no matter their chronic condition. Let's talk
something.
Please go ahead.
Just one small thing is make a drawing of your patient journey. So really put on a paper, just draw a line. When did you have what type of symptoms? What type of treatments did you have? What type of physician? And go with this simple one-pager to the physicians, because this will really help them to ask different questions as well. And it will give a better view about your past journey, especially if you haven't been a patient at that clinic. Because if you are always at the same clinic, most probably they will have this information. This really helps, and this changes the conversation you have with your physician.
I love that approach. I would call it researcher's approach. This is excellent. I really like that because it really helps to visualize. And as I was listening to both of you, something crossed my mind is that, especially when Victor just started by saying cholesterol or maybe other issues that we might have, right, take the priority. And I'm wondering, why is that? Because when you say my quality of life was affected, I think it's just a statement that does not uncover the full problem of your story, because it sounds almost minimizing your quality of life, right? It's not just quality of life. People really get sick. They're dysfunctional. It's almost surprising, I would say, that such a small part of our body as sinuses, it's not big, right? It's just part of our heads. But the way it affects us is really unbelievable. And even though, let's say, a hand injury could be pretty much the same on the surface, right? If we calculate the surface area of the hand versus the sinuses, it might be comparable. But when we have injured hand, we can function. We can think, we can dictate, we can make adjustments to our work schedule, workplace, etc. But with the sinuses, the brain fog is so dreading, and people just cannot function. And this is basically taking away some of the most productive years of our lives when we have this condition developing. I think someone said at the age of 22, right? And I think this is where you study, you start new jobs, you build a family, etc. And this is where you don't feel functional. This is a very strong impact on the quality of life of people who suffer from this. And as I'm thinking, why do we not have such a priority? So I'm, again, super grateful that we have this Awareness Day. And I think it's probably because we don't have really good diagnostic tools. And even though, let's say, cholesterol is also invisible, but when you show the doctor your numbers, you go to the lab, you draw your blood and show, like, I have cholesterol, let's say, of 200. The doctor will start thinking, oh my God, this is high, let me do something. But when we talk about nasal polyps, we just don't have any biochemical markers at this point, except for eosinophils, which, unless we work with them closely, actually do get overlooked by many. And so I think that's where we would like to put our efforts, is really to do more research and finding a good biomarker that can help people to go to the doctor with this drawing that Mitch has suggested and show it to them. And on top of it, say, and this is my biomarker level. And that's where the doctors will say, okay, you really need help. I think that's super important.
I agree with that. I love the idea of the image too, because the other thing that happens is you get into the doctor's office and you forget half of what you were going to say unless it's written down. And I think, notice that Dr. Jerschow is nodding, so it must even happen to doctors themselves. So appreciate that. I think the other thing, going back to these other conditions that are getting more attention, is when you think about things like cardiovascular health, diabetes, etc. There have been very large public health campaigns and education around those. So I think it's even more important that we're shining a light here today and through some of the other work I know we all do to get some attention to this, so that people don't feel like they have something that cannot be addressed and they're not the only one that's suffering from it. So I'm sorry, I got to keep us moving along. We've got so much more so many more good topics to cover. Let's take just about a minute each, if you would, just to tell us about your treatment journey. Victor, do you want to start?
So as I started with antihistaminics for like 10 years, which is wrong treatment. That was totally not what you have to do. And then when I went to the allergologist, I was lucky because my nasal polyp went away with nasal steroids. So that's what I have now. That's my current treatment, and I only use them when I have like an exacerbation. I don't know if that is the right approach, but that's the approach that I have for now with this doctor.
Okay. And how about you, Mitch?
Mine was a little bit more complex because I was initially diagnosed with eosinophilic syndrome. So then they just put me on high dose of oral corticosteroids. And as I mentioned before, I was actually looking for solutions to get rid of these oral corticosteroids. And then I actually, okay, indeed, I'm a researcher from background, so I looked for clinical studies to see what physician, who is working on this type of disease, and what are they publishing. And I actually sent them an email. I think that you're doing a trial. Can I see if I am eligible? And then I ended up in a clinical trial to test one of the anti-eosinophilic biologics. And then I could indeed reduce my oral corticosteroids with, I think, 20%. So it was like a semi-responder. But then the problem was always I want to taper down my corticosteroids. My nasal polyps were my biggest issue. My asthma was okay. This was under control, but this not. And this really, I was always trying to go down, but then the quality of life was so bad I say go up again because I don't want to live like this. And then I'd rather take high dose of OCS. So I wasn't happy with that biologic. So I switched to another biologic, and actually the same, medium responder. And then I ended up in a new clinical trial. And here I really have to say thank you because this has a big impact.
Was just going to say that I think reaching out to the researchers that you see in the literature is professional level self-advocacy. So I applaud that because it takes a lot to get to that point, right? And to feel empowered to do that. So two different experiences here. I'll ask Dr. Jerschow, how do these experiences compare to what you see as sort of the average patient go through, if there is one?
Yeah, that's a great question, Kristen. I think just like we see from these two, I would say almost extremes, right? So a lighter case versus a worse or heavier case. And so that's what we see. We see a spectrum. And I think it's not uncommon for any condition that we treat, right? So I think now everybody is very familiar and proficient with COVID. And that might be a good example because we can have patients who die from COVID. And we also had patients who didn't even know they had it, right? So it's a really impressive spectrum of the disease. And here we have a spectrum as well. So I think, nasal lavages are very important. I think biologics for patients who have a more severe condition is also very important. One thing to keep in mind is that over time, the disease can progress. So it may start lighter, it can get worse, but overall, I think maybe that's a piece of good news. What we have noticed, although there's not much evidence that is published, but it looks like with age, the condition does get better. So my oldest patient in the study, she's now 93. So when I ask her how she's feeling now, she says a lot better than in my 40s. So that's encouraging.
That is encouraging.
Yeah, and one more thing I'd like to mention is that first of all, I feel that Mitch is in a very good healthcare system in Belgium because they have an excellent group, as far as I know, in Ghent, who is really working a lot on nasal polyps, on sinus disease, and biologics that are applicable. So it's good to be in such a place when you have nasal polyps, but not everybody is has access to these resources. So one more thing I would suggest to people to consider, and again, hopefully most of the patients that are listening can have access to this option, it would be to see an ENT that is specializing in sinus disease. In the United States, we call them rhinologists. So they don't do any ears or throats. They really focus just on sinuses. And the outcomes are dramatically better, I would say, when people see a rhinologist versus someone who is less specialized. So that would be also my suggestions to patients who go through this condition.
maybe if I can add another point here as well, is that the experience with adherence to medication. I think it's really something that you really have to take it serious as a patient. And just for example, indeed, nasal steroids as well. So it's often a maintenance treatment for a lot of patients. Also, my experience is that the moment that you feel good and you think everything is okay, you have the tendency to lower your adherence rate. And this is actually what you shouldn't do. So of course, always listen to what your physician tells you, so everyone is unique, but listen and really know and understand why you have to take a certain medication and what the importance is of adherence. Because the more you understand that, and the more you also see how this can impact your life, the more I think you will actually adhere to a treatment. And I think treatment adherence is really something that is not to be underestimated, and it really it can have a very big impact on your treatment response and your quality of life.
I think we all, as humans, will think that will not happen to me. I'm very good about taking my medication. And every single person on the planet, we see the data show that we are not good at taking our medication as prescribed unless we really, really stick to it. I love the idea about knowing why. When you understand why, you understand why it's so necessary for you. So I really love that. All good tips. And I will ask you about some more tips in a few minutes, so you'll be ready for that. Dr. Jerschow, you did allude before a little bit to things getting better as you age. You talked about that, right? So that's promising. Can this be cured?
Not that we know of. I mean, not completely, let's put it this way, because just like Victor and Mitch said, they still need to have lavages. And even if some people are on biologics, many need lavages as well, because if they don't, there must be something about a consistent level of inflammation inside the sinuses that maybe promotes the growth of the polyps, so the polyps can recur. One thing we know for sure is that people who have NSAID sensitivity, they also have a worse condition, meaning they tend to recur the polyps a lot faster and more frequently, which results in many more surgeries in this group of patients than patients who don't have NSAID sensitivity. And so, however, even those who don't have NSAID sensitivity, once they stop lavages, they tend to be more likely to recur. I'm sure there are some exceptions where people don't have to lavage as much, and maybe at a different frequency. Instead of every day, maybe they will just do it when they have a viral cold. So to prevent the inflammatory response going towards polyps again. I would say, in my experience, those are minorities, meaning not many can do that well. Overall, I have experienced the best outcomes with my patients when they have been compliant, even if it's at a different frequency. Let's say instead of twice a day, like most people would recommend to take lavages, they would do it maybe a few times a week, but they consistently do it. And I think that's what really sets them up for success.
Very interesting. Another adherence advocate here. Yes. How about prevention? You mentioned before when we were talking about sometimes these can be seen more commonly in areas where there's high pollution. Can we as individuals take steps to prevent, like staying away from polluted areas, etc.?
Yeah, that's a very good point. So there are a few studies over the past, I would say, 10 years on nasal polyps that indicate when people have been exposed to smoking, tobacco smoking, for example, as children, so secondhand smoking, growing up in a family where everybody smoked, for example, or if they have smoked themselves, but at the end, both have stopped, right? So the secondhand smoking exposure is no longer present. So they're adults, they live by themselves, nobody smokes around. And then the second group, they smoked, they stopped, and no longer smoke. So this sets them up. Some people, I would say, there are probably some genetic differences and some predisposition that makes people more likely to develop polyps. So in this group of people who we probably wouldn't know if we are these people until we get it, right? Because we don't do the screening for that. So this group of people is more likely to develop polyps. And in the last 2 years, there was one study from Finland where they identified that pollution exposure, the more pollution exposures people have, like vapors, fumes, some detergents, etc., as well as smoking, the more pollution exposures they have, the more likely they were to develop nasal polyps with asthma and NSAID sensitivities. We just published last year from Bronx, New York. And again, we identified a specific group of patients who developed polyps and NSAID sensitivity before asthma. And those were the patients, mostly men, by the way, which is a little bit different for those who have asthma, because usually it's with women prevalence. But here we had men who reported pollution exposure as well. And so when we asked, it was self-reported, when we asked the pollution exposure, we defined it as working in a car shop, being a railroad technician, industrial kitchen exhaust cleaners, as well as being literally living on a highway, which is a very busy highway in United States. It's called I-95. It connects Florida with Maine, and it actually goes right through the Bronx. And so some buildings are literally facing that highway, and living on this highway seems to be associated with higher prevalence of polyps and asthma.
Very interesting and good for us to know this week being Earth Day, something to keep in mind. I'm going to jump forward to tips because I think these are so helpful. Can this group give people who are watching us today tips for self-managing, for living well, living your best life, thriving with nasal polyps? I'll open that up to the floor too.
So I think the tip that I would like to give, because one of the let's say the affectations that I had is the mental health part, because I go to the gym every day, right? And then your nose is like stuffy, and then it was after COVID, everyone thinks is sick and they stay away from you. Or the gym instructor will say, if you're sick, you cannot come to the gym. It's like no, it's allergies. Situations like that, they're very common, especially after COVID, that the people think you're sick. And I work with patients, right? So it's even worse. So I think that looking, if you don't have access to like a mental health support, like find a family and friends who talk about it and get that support, because there is a stigma with this. If the symptoms are not controlled, you are facing some some stigma situation. I don't know if Mitchell, you agree with that.
Yeah, absolutely. I think it's indeed, especially during COVID, there was this additional load, let's say, and like you said, Victor, the mental impact is something that is not to be underestimated. On top of that, I think like tips that I would give is really search for testimonials. Yeah, because you're not alone. Yeah, it's really interesting to see how much inspired you can get by actually reading testimonials of other people, watching to small videos, because this will trigger you to ask different questions when you are in the physician's office. Secondly, I think, and this is what I personally do because I'm a geek as well, keep track of your symptoms. So really, for me, this helps, even if you don't have to do this daily, but when you really think that, okay, things are not okay, try to just note down on a scale from 0 to 5, okay, am I completely constipated or not? Do I smell, whatever? And maybe you will discover some patterns as well. Maybe not, maybe yes, but that really will help you to get more understanding about your body. And this for me is also part of the equation of self-empowerment, is to actually understand where are you in your journey. Personally, I also have a very small sensor that measures air quality. So I like to just carry this around with me to just, be aware, like, okay, what is the environment that I'm in? Like I also had like some allergy like symptoms, but they never could pinpoint it. Even so today, they can't really say why or what. And it seems very random. And so that's why, as I mentioned, I'm a geek. I like to follow these things. And at least, sometimes you will see some tendencies and you can start thinking like, okay, could there be a relation? And just have this very open conversation. And this is the next step really openly talk about these things to your physician. Don't be shy. Don't keep things back. Just put everything on table, prepare your consultations as well, and really make sure that you have this conversation and not just this unidirectional situation. At the end, they want to help you, these physicians, and you want to be helped. So really be open. This is, I think, very important as well.
I really appreciate that. And I think that obviously we're all a little bit geeky, right? And here on this call for sure. But I think the other thing I'll say is that it doesn't have to be that you track these in an app or in your phone. You can just track your journey on paper with pencil, and that will do just fine when you get to your physician. You'll have this entire history that's there. And again, it'll help you to remember, I think, which will be helpful. Dr. Jerschow, did you want to add anything to those tips?
Yeah, I love the tips. I think having this partnership between patient to patient or patient to doctor and back is really important. So I think doctors who are interested in the condition are more likely to know about it and more likely to know the strategies and be more up to date. So finding a team of doctors who are interested, knowledgeable, and ready to work with you is really important. It's also, I just like the idea of the testimonials and connections to others, because it could be very devastating to have the disease and think that it's just me, right? Like many of my patients say, it's just me. But it could be truly devastating when you hear stories of a young mother who says that she discovered she has some problems when she couldn't smell the diapers of her baby. Or an older person was by themselves at home and couldn't smell the smell of gas, which a neighbor came by and noticed, and that basically saved his life. So it's very difficult, but if we know that there is a group that works on this, and in the United States, I'm aware of a very good supportive group called Semtest Triad Society. So that relates to asthma, polyps, and possibly aspirin sensitivity. But many of my patients who don't have aspirin sensitivity are also members of this group. And I believe they have a Facebook group that is more than 5,000 members, if I remember correctly. And they are very active, and you can ask any questions and you can get a lot of responses right away. People are sharing what they have went through. And so now that's one group, but I think we are missing a wider perspective where people with just nasal polyps could be included easier. And I think that's what we need. So once again, this awareness day might be very helpful. And yeah, so this would be my suggestions, just emphasizing what Victor and Mitch have said so far.
Yeah, I think nothing replaces, no matter what condition you're talking about, that person to person, the patient to patient interaction. No one understands it better than somebody else who goes through what you do. I'm just going to bring up my screen again here because unfortunately we are running out of time. There's so much good information for us to talk about. So thank you all for being here today, and thank you for sharing your experiences, no matter sort of where you are with this. I want to say that the GAAPP efforts about nasal polyps will extend beyond just Awareness Day. So these things here, you'll see updated web content on our website. We're going to be producing educational flyers so that you can know more about nasal polyps no matter where you are in this journey. We'll have additional communications around nasal polyps that you can get out to your communities so that they know more about this, and a social media toolkit that will help you to do that. So we thank you for being a part of this entire effort this year. And of course, again, to my speakers today. I also want to thank GSK for their support for this event. Thank you very much for that, allowing us to do this. It will help a great deal of people. So thank you. And lastly, thank you to the people who have joined us today. We so appreciate your time. I know some questions do come up after the fact, so please do email us if you have questions at info@gaapp.org. Thank you to everyone. I hope you've enjoyed this and enjoy your day.
Thank you.